Well, good afternoon once again. My name is Will Russell. I'm joined again by Dr. Jim James, who is a former director of the AMA in the world of epidemiology. He also is the editor-in-chief of a scholarly journal on epidemiology, and is an adjunct professor at the University of Georgia. And we're going to have another update today about COVID-19. So, Dr. James, how you doing, sir?
I'm doing wonderful, and yourself?
I can't complain. If it was any better, I couldn't stand it.
I'll do the complaining.
So, anyway, I wanted to get a quick update about how the last time we talked, cases were going up, leveling off slightly, deaths were coming down, but also leveling off slightly. Where do we stand with those numbers right now?
Well, today, actually I'd like to take a perspective of good news. And this morning, I looked up the 7-day moving average for cases. And we are down 40% in 1 month from the same date in July as we are today. So the curve is definitely on the way down, and it's down quite significantly. If you trace that curve, if the slope stays the same, and you trace that curve down, we could be at what's called an endemic level, probably within a month to a month and a half.
So what is endemic mean?
Endemic is like any disease that we have. If you want to look at infectious disease, you have measles, mumps, whooping cough. AIDS is probably the best example, HIV/AIDS. It's not something we've ever conquered. It's just part of that medley of diseases out there that afflict us all. And my feelings are with COVID that before we reach a point where we have an effective vaccine, we're going to reach that endemic level. Exactly where that will be, I don't know. But it will certainly be at a level which we can much more easily adapt to. And it won't change the basic thing with this disease. Its medical impact is a disease of older people. And I think we need to really focus on getting everyone else back to normal.
Mm-hmm. Now, I did see certain reports that they are saying that the lockdowns have had a lot of effects and driven death rates of a lot of other things up. What triggered my thought on that was you bringing up HIV/AIDS, because I saw somewhere that deaths from AIDS have gone up drastically from the lockdowns, other things, suicide, depression, alcoholism, heart attacks, other untreated things. How do you feel about the lockdowns, and do you feel that they have been counterproductive?
I think they've been counterproductive. But like most things here, I don't think it's yes, I don't think it's no. I think when you have extreme conditions, like you did in New York City back in March, April timeframe, obviously you have to take some kind of measures to try and stem that. Also back then, we didn't have the same understanding of the disease that we have today. But from what we know today, I think the biggest single problem we have is we continue to report this in terms of cases. A medical case should be symptomatic of some type. You should have symptoms, you should be injured in order to be a medical case. What we're classifying as a case is a positive lab value. If you take all the people that are positive, approximately 10% will end up being hospitalized, and a much smaller percentage of those will end up with the very severe, critical, and negative outcome. I think the bottom line figure, if people would only look at it, with all of the media reporting and everything else, the overall attack rate for the whole United States is still less than 2%. So that for every 100 Americans, less than 2 have tested positive. And that doesn't mean they got sick. Again, those are just the positive tests. I really believe we need to be looking at the impact of this disease in terms of hospitalizations and mortality. And both of those are significantly down and different than they were at the beginning of this.
So has your opinion on the way the media is covering this changed at all since our last talk?
No, I think it's become politicized. I think most people in America realize that. And, I personally try and stay away from, either left or right and try and look at the numbers and what the numbers tell us. Part of the problem is when you have an opinion on something, if it doesn't correspond to what one side believes, then you're, stamped with, the mark of supporting the other side, and that's not the case. I believe we're at a point where we've learned enough about this disease that the herd immunity level, which will be protective, is much lower than we originally thought. And I think by the time we reduce the number of susceptibles down to 60% or so, we are going to again have a much lower endemic state of the disease. And we can adapt to that fairly easily. In fact, we should be able to adapt to that more than we do to most diseases, because again, I don't know why we seem to lose sight of the fact if we protect the elder and the confined, we're taking care of 80 to 85% of the negative medical impact of the disease.
There's been talk in Virginia especially, but in other places like Massachusetts, of forced vaccinations once it's available on the market. From a public health policy, how do you feel about that approach from state health officials?
Well, I don't think it'll ever work, quite simply. I think we have already seen overarching government in terms of many of the mandates they've come out with, which don't have a good basis in science, if you will, certainly not proven. But when it comes to forced inoculation, I think you're really stepping over the line legally and with your authorities. I remember in my military days when anthrax vaccination became available, and the requirement came down that all deployable military folks had to get the injection. And there were, a significant, not an overly large, but a significant number of people who refused to get the vaccination. And it was never forced on them. And I just really don't see in this country where we would reach that level of a police state where people would be doing forced immunization.
And we're getting close to September now. Some schools are going back, some schools aren't. Some schools are doing a hybrid approach. You've seen North Carolina, I believe, the University of North Carolina, they came back for a couple weeks. They had 200 cases. They've closed it all down. Is your stance on schools still, we need to reopen and reopen?
Absolutely. And I'm not talking so much about the colleges and, higher education. But when we're looking at K to 12, you're looking at 55 million young Americans. They've already been robbed of essentially a year of school. If you look, now there's no definitive studies because they're just so difficult to do and we don't have the database for it. But if you look at surveys that have been done, I really think we're hurting all of the students socially, we're hurting their futures economically, we're disadvantaging them educationally, and which is the group that is suffering the most? And survey after survey shows that. It's the lower socioeconomic groups, the very group where we're working so hard to bring, together into the mainstream. And I think this is a wedge that's going to be very difficult to overcome. And I really do believe that this is institutionalized child abuse. The children are not at risk. We've been told masks and social distancing, et cetera, work. why are we not protecting the teachers and allowing the children to progress, as students and as citizens and human beings? I just do not see the logic of depriving a group to the extent we're depriving when they are almost at zero risk of a negative outcome from what we're protecting them from.
That makes me think about the new appointee that President Trump has brought in, Dr. Scott Atlas.
Right.
Now, he has taken a beating in some of these media reports for making a similar statement that kids are almost at zero risk from healthy kids from a negative COVID-19 outcome. So do you know anything about Dr. Atlas? Do you think his appointment is a good one? And do you think that maybe he'll balance out some of the things we've been hearing from Dr. Anthony Fauci?
I think you said, and first of all, I don't care if it's from Dr. Fauci or anybody else. I think what we have seen in the administration and at the highest level is kind of a unity of recommendations and opinions. Most of these things, the word science is so important. And so much of what we're doing is based on a very limited understanding of things like how many people have been exposed, to what degree, how many have developed any kind of antibody protection, et cetera. So when you look at someone like Dr. Atlas, it's not so much that, he's in opposition to a Dr. Fauci or one of the others. It's balance. There are people that have other opinions. Most of mine I share with Dr. Atlas. Dr. Atlas also is one of the first I have seen who has brought up what I have tried to discuss is the herd immunity effect, which is a naturally occurring effect. You asked before, are there any negatives kind of to the lockdowns? I think the more people out there who end up test positive, end up developing some immunity, the faster we're going to increase the level of herd immunity, and that's going to decrease the rate of transmission. We'll have, like I said in the beginning, an endemic state, which we will be able to handle. It will no longer be that epidemic pandemic. I think the media has just done such a good job creating this psychology of fear in so many Americans where the actual risk does not support it.
And is there anything new in the research world that you've run across that is different from last time, that's maybe interesting about the virus or about measures or anything that you think would be good to share?
Well, first of all, I don't think there's anything really new under the sun.
No.
They had a report yesterday, first case of reinfection documented. That's one out of 25 million global cases. Okay, I don't think those are the kinds of things we need to focus on. I'd rather focus on where we are with the developments of three things: the medical interventions, pharmaceuticals, and quite frankly, I don't think they've been very successful. They had a few promising ones. I don't think they've worked out. The second is the serum approaches, using blood products that have concentration of antibodies from previously infected people. I think that shows, some promise, but that's not something you can manufacture. That's something, people who have had the disease have to step forward and have to be willing to donate blood so you can do the work you have to do. The third is the vaccine. And I know so many people are depending so much on the vaccine. They're looking at lockdowns and school closures and all of this stuff as a finite thing once we have an effective vaccine. I think that's just a terrible mistake to make. Like I've said before, it's 40 years later, we don't have an HIV/AIDS vaccine. We have medical interventions. And I know some of the vaccines look promising, but the second question is, how effective will they be? Most flu vaccines, on average, are 40% effective. They're even less so for the elderly. Who's the at-risk group for this disease? The elderly. The thing that's really bothersome, they just had at the National Academy of Science a 3-day meeting on vaccine and the anti-vaccination efforts that a lot of people really get into. And from the major surveys, well done, it appears that approximately 50% of Americans have serious doubts about taking the vaccine. Gets back to what you were saying before. Are we going to mandate immunizations? We don't even mandate immunizations for measles, a really serious disease for our kids. And we're going to mandate for 50% of our population going around and jabbing them. One final thing, and it gets back to what you asked about Dr. Atlas. He's one of the first ones I've seen that have really come forward with something that I think we seriously need to look at. You know, we compare what we're doing today with what happened in 1918, what we're doing with this disease or that disease. The fact of the matter is, the 80% of the people that have negative outcomes with this disease are over 65. You can't compare that to a disease where 80% of the negative outcomes are in 35-year-olds and younger. And, you know, that life years has always been a very accepted public health measure. But for some reason, people have been reluctant to go there. And they're reluctant because a life is a life is a life. And of course, we're trying to protect all life. But from a public health perspective, and you're trying to evaluate the outcomes of different interventions, you have to look at the total life years lost with one approach versus the other approach.
Well, I think that's a good place to wrap up today with Dr. Jim James. And again, we're going to be checking in soon here with another update. And I guess we just hope that the case numbers and the deaths and hospitalizations continue to trend downward. And you know, hoping that we can continue to see some opening up of the economy.
Well, like I said, and just to repeat, if the slope of that curve continues, I think we'll be in a much better place a month from now. That's not a prediction, but it's a hope. And I think a few weeks from now, I think a report back would be a timely thing.
That's what we'll do. Appreciate your time today.
Thank you.